So good morning, everyone. So my name is Richard, and I'm from Newcastle University in the UK. And I'm presenting on some work today based on some research we've been doing with e-cigarettes for patients with periodontitis that I'll explain a little bit more about. I've no conflicts of interest, and I'm funded by the NIHR in the UK. So tobacco and oral health are known to be intimately related. And the two main conditions we think about are oral cancer or periodontitis. So periodontitis is essentially severe gum diseases, and it affects about 10% of populations worldwide, and it's the sixth most prevalent health condition in the world. So that's kind of my day-to-day job. And the research we're conducting in our unit is a randomized controlled trial looking at e-cigarettes within this setting to help our patients stop smoking. So we're randomizing 80 participants, so all smokers with severe periodontitis, to either receive usual care, which is smoking cessation advice and support, or usual care plus an e-cigarette. This study's been running for a few years and actually just finished last week, and we're doing all the kind of quantitative data analysis at the minute. The work I'm presenting today is some of the qualitative stuff we did. So we did some interviews on a subset of participants to understand how this intervention worked and their perceptions about e-cigarettes. The quantitative stuff will be presented, or ready to be presented later this year, which is really exciting. So the aims of the work today, I'm presenting today, were really to explore just generally the perceptions of e-cigarettes of this sample, so of patients attending a dental healthcare setting, and then to dig into those who are provided with an e-cigarette, what their perceptions were of that, and the feasibility of doing that in a research setting. So my design was semi-structured interviews using a theory-based kind of technique, and we interviewed 28 of the participants in a purposeful sample. So half the participants got an e-cigarette starter kit, which I mentioned before. So they received a second-generation device. They got a spare tank, a spare battery, 2 10ml bottles of e-liquids, some written information, and a short tutorial, and then were sent on their way. So my demographics of the sample, so they were early middle-aged and relatively heavy smokers, smoking around 19 cigarettes a day, and an expired air carbon monoxide of around 21. So on to my results. So with regards to general perceptions about e-cigarettes of the patients attending the dentist, there were 5 main themes that developed. So for each of these, I'm going to touch on it, explore the kind of, or tell you about the main kind of concept, and give a quote to illustrate it. So the first one was that our participants were really strongly influenced by other e-cigarette users they'd come across in their lives. And that was almost overwhelmingly a positive experience. So an example quote here is, a lot of people I know, they seem quite positive about it, vaping. And I haven't had any sort of negative feedback or anything about it. And the second quote here is from someone who perceived more the benefit in stopping smoking from people around her. And she says, a lot of the girls at work have been really successful with the e-cigarette. About 6 or 7 of the girls have stopped smoking with the e-cigarette. So generally a very positive influence being imparted on people. It wasn't exclusive, and this participant was aware of this positivity around them, but was more skeptical in themselves. And they say, a lot of people say, well, it's a lot better than smoking, but the amount of people, it's ridiculous. A lot of people must have positive views about them as well. So they were a bit more skeptical in their viewpoint on this. The other thing was that to be eligible for our study, participants couldn't be a current e-cigarette user, which means that in the last month they couldn't have been actively or regularly using an e-cigarette. But over 2/3 of them had previous experience of e-cigarettes, and that was almost overwhelmingly negative, and that was a strong theme that came across. And I know this was mentioned in the earlier session. And some of the things that our participants spoke about was leaking devices or tasting really funny, and this one participant said they could taste the electricity in their mouth. So this is kind of being brought up by our participants. This leads on to the next point, which there was big concerns about addiction to the e-cigarette or to nicotine. So people worried about just replacing one addiction for another and being over-reliant on the e-cigarettes. And also about lack of control. So in this participant is talking about they know exactly what they're getting from smoking, and they're not sure how they're going to manage to cut down with an e-cigarette. Maybe that's just an excuse, but it came across quite often in the interviews. Health considerations, maybe not that unsurprising given the context of where the interviews were being conducted, were a strong theme that came across. And a reasonable number of our participants had the view that e-cigarettes were less harmful than regular cigarettes. And this is a quote from a participant who's recently switched. So they say, "I feel better for it switching. I really do. I don't feel like a smell, my mouth feels a lot healthier, I'm not wheezing, I'm not coughing in the morning. I just feel myself a lot healthier for packing in real cigarettes and going on to the e-cigarette. It's a massive difference." So that was quite a strong theme, but it wasn't exclusive. And there were quite a few participants who had negative views on the health aspects of e-cigarettes. So this is quite an interesting quote where the female participant says, "I did go on the e-cigarette for a while, but then my mum fell seriously ill. And I've actually been looking up this week about it, and from what they described, apart from the tumour, she had popcorn lung, which is part of the e-cigarette or so they think." And these sorts of negative health views were quite common in some of the participants, and popcorn lung was actually mentioned a few times. Social acceptability, so there were mixed views on this. So this top participant feels very comfortable using it anywhere, walking through the town. And the second participant here had more negative views. She said, "I think if you see someone with an e-cig, you just know they used to be a smoker. It doesn't look attractive. I think they're awful." So there were quite contrasting views here. Now digging into the subgroup who we gave an e-cigarette to as part of the study, there were 3 additional themes that developed in this group, which I'll go through as well. So the first was the benefits of the behavioural similarities to smoking. So lots of our participants spoke quite in depth about how it really replicated their habit and how they found that really helpful. So this first participant's talking about holding something in their hand, a bit like a pen, having that hand-to-mouth action. And the second participant here is talking about blowing out smoke, getting a throat hit, and how they found it quite an easy replacement, and they found the transition quite straightforward. Flavour was a really prominent theme that came out, as you might expect. So our participants had 4 flavour options. So they had a tobacco choice, a mint choice, a cherry choice, and an unflavoured choice. And they could choose two options to go away with in their starter pack. And less than half chose a tobacco option within that range. And they could also choose a nicotine concentration, and the most common was 18 milligrams per milliliter. When we explored the flavour choice in a bit more detail in the interviews, there was very dichotomous views in this. It fell into 2 camps. There were those who were really against tobacco flavours, and they said it was too similar to smoking. And there were those who were really for tobacco flavours and they wanted to replicate that. And the kind of the implications of this as a researcher is we need to at least have a few flavour options in an intervention we're delivering. And the research studies that only give one flavour option from our results are really disadvantaging a proportion of the patients. There are a few technical issues. These are generally fairly minor, and it generally affected some of the older participants. And interestingly, it was often younger family members or friends that ended up helping out those patients in getting over the technical difficulties. So thinking about my study, there are some strengths. So it was fairly robust how we conducted it and representative. And it's the first piece of qualitative research looking at e-cigarettes in the dental healthcare setting. Some of the limitations. So the study was conducted in a clinical setting for some of the practical limitations of conducting it, and by myself, a dentist, so that potentially influenced the results. And obviously, of any qualitative research, there's potential for interpretation bias. But the 2 main conclusions we've kind of drawn from this are that smokers perceived quite positively the provision of an e-cigarette within the dental healthcare setting for smoking cessation. But there were a wide range of positive and negative kind of preconceived influences about e-cigarettes that we need to think about when we design future interventions or approaches, whatever it might be. Yeah, so look out for the results of the main study later this year, and I'd like to thank all the research participants for taking part, and the research team, and obviously my funder, and we're doing questions at the end. So thank you very much.